Hi, my name is Zach Jenkins, and I'm an associate professor of pharmacy practice and a clinical specialist in infectious diseases. Over the last several weeks, we've covered a lot of COVID-19 topics, but there's been one interesting question that's really risen lately, and that's this idea of, could I use a COVID-19 patient's blood to treat someone else with COVID-19? We're going to be discussing that today. At the time of this week's recording, we now have close to 1 million cases being reported in the United States. We have over 50,000 deaths and over 100,000 recoveries. As I mentioned, there's been a lot of buzz around this idea of potentially using a donor's blood, a donor who's had COVID-19, to treat other people who actually have that infection. So this article actually highlights that 4 different states had developed formal programs for plasma donation in order to treat COVID-19. And these states are not the only states in the country, by the way. There have been many other institutions, many other states and localities that have started to put programs like this in place. When we typically think of blood donations, we think of actually just drawing blood up, and it kind of looks like this. It's just your typical red blood that you would think of, and that normally gets used to treat people who may have some sort of blood loss. But plasma is a little bit different. And so plasma itself is actually the liquid portion of the blood, and that liquid contains nutrients, it contains proteins, it contains clotting factors that actually help you to clot whenever you have like a cut, and then it actually can contain antibodies as well. And so if you look at this test tube here, what this represents is when someone's actually taken blood and they've spun it around through a centrifuge several times, and they've actually separated that plasma component out. And so that's that top almost amber colored liquid there. The middle portion represents white blood cells, and the bottom portion represents something called hematocrit, which is really just red blood cells and platelets. So that top portion we use to treat specific conditions, but when we think about COVID-19, we think that these antibodies actually may play a real role. So in order to really get to this point of discussing what plasma is, where these antibodies play a role, I thought it'd be important to really step back and think about what our typical immune response is. So when we think about COVID-19, we know that it actually comes in contact with a person and causes an infection, and we know that there's an immune response, and we've detailed that quite a bit over the last several weeks, but I'm going to break this down at a more granular level. So in a person, what happens is the antigens that actually are present on these viruses interact with a type of white blood cell called a B cell. And these B cells actually digest that antigen. And when that happens, it causes the B cell to really try to signal something called a T cell, which is another type of white blood cell, to pair with it. And when these two cells come into contact with each other, that T cell helps the B cell mature. And that B cell, ultimately, when it's matured, is called a plasma cell. And that actually develops antibodies. So in order to actually develop antibodies, you have to cause a B cell to mature. This is all triggered by antigens, those substances that are unique to whatever virus or bacteria that we're talking about. So how this plays out practically is once you've developed antibodies, they end up kind of engulfing or flagging or painting the target. So they bind to these antigens that are on these viruses. And that tells your immune system that this is a foreign substance. And so as a result, the immune system ends up targeting these foreign substances, and it causes it to do one of two things. One of which is it can cause it to undergo something called phagocytosis, which is a fancy word for meaning it gets eaten up by white blood cells. And so if you kind of look at this image, you see something that resembles sort of Pac-Man eating this virus. And so just to complete the Pac-Man picture, we're going to go ahead and give it an eye. But that's phagocytosis. That's one mechanism that this occurs. But the other thing that we can actually see happen is these viruses can also lyse, and that's where they burst and they dump their particles out. So these are the two different ways that your immune system typically responds. Once these things are actually broken up or gobbled up, what your body does is it actually filters those out through your spleen or through your liver, depending on what substance we're discussing. So this is your innate immune response. And your immune system is, of course, more complicated than what we're really painting the picture of here. But this is what we think about when we think about antibodies. So the question becomes, wouldn't it be great if we could step back and take those plasma cells and give them to another person so they could develop that long-term immunity? So the theory is, if someone is actually at the stage where they're producing that immunoglobulin G, that long-term immune response, that's when we think we could transfer plasma cells over. You see, every plasma cell can only produce certain kinds of antibodies. And so in those later stages of the immune process, that's when they would be candidates. And so we think by transferring these plasma cells over, we can actually confer that innate immune response with those patients. So those patients can then produce their own antibodies that are active against COVID-19. Now, this seems like a very novel strategy. I mean, it sounds new, but quite honestly, it's not so new. So if we take a step back in time, we actually were using this as early as the late 1800s. So specifically, they tried this out in patients that were struggling with diphtheria and saw some success with it. That then carried forward to 1918 when we dealt with the Spanish flu, which, if you've been following the news recently and our response to COVID-19 and social distancing, this should ring a bell. Spanish flu was when we last used that in such a capacity. But we used it in the Spanish flu and saw success. Now, we've used it a little bit since then, but what we actually encountered is after 1918, antibiotics and antivirals started to take the front with treating these patients. They were more effective, quite honestly. And so convalescent plasma was not one of our treatment strategies that we typically employed. However, we have been trialing this as recently as the 2000s. And so we used it against SARS. We trialed it against H1N1. We trialed it against MERS, which is another type of coronavirus as well. And then we trialed it most recently against Ebola. Now, with the three previous ones, that being SARS, MERS, and H1N1, those were all found to be somewhat effective. But unfortunately, Ebola was not effective, so that wasn't something that we saw success with. So I want to paint that picture for you just to say that this doesn't necessarily guarantee, even though this principle sounds great in theory, it doesn't guarantee that there's always going to be activity. So what does our evidence currently say related to COVID-19? Well, one study that actually came out of China looked at 10 adult patients, and they actually didn't have a control arm in this study. So once again, we run into this problem without a control arm of potentially introducing bias because you have no real comparator. You can't say that this is better than whatever standard of care is. But in this case, they had no control arm in these 10 patients. And another limitation of this study is all these patients were receiving other kinds of therapies, so that being steroids or antivirals that were under investigation against COVID-19. So that's another limitation because you can't say whether this was better than just those elements. But what they did see is when they used convalescent plasma, they had improvement in symptoms in as little as 1 to 3 days. There was some decrease in the inflammatory markers that we would measure in an institutional setting, and they didn't really see any deaths. So that seemed pretty promising. There was another study that was recently published in the Journal of the American Medical Association, and this looked at 5 critically ill patients with organ dysfunction. And they ended up seeing that despite some of these limitations that are very similar to the last study that we talked about, they had a normalization of temperature in 3 days. And if you remember, fever is a really big thing that we run into when we're dealing with COVID-19. Beyond that, we had improved organ function and improved oxygenation, which are 2 other things we commonly see with COVID-19, and they didn't see any associated deaths. So even though this is a small study with some similar limitations, it looked a little promising. There was also a case report series, and this is not necessarily designed like a study, so keep that in mind. It's a series of just case reports that came out. And what they found with each of these cases is that all of these patients exhibited some kind of positive outcome. Now, it varied based on the patients that were present. There was a patient as young as 31 years old. There was a patient as old as, I think, in their 80s. And so there were some variations in the patients they looked at, but they all had some level of success. So because of this, it's gotten a lot of people excited. And they've thought, well, if I've had COVID-19 and I've recovered for it, can I be a donor and potentially provide someone with the treatment option? And so what you see here is actually an article that was published in ABC News, and it highlights how one survivor launched a plasma donor group to help contribute to the cure. And there have been a lot of examples of this coming out there. There was actually someone locally in Dayton, Ohio, which is very close to where I practice. They actually had come out and publicly stated, I want to help these people not go through the same thing that I've gone through. And so he donated plasma in his case. So there are opportunities out there because this is something we're actively investigating. So the programs that you typically would think of, there's one available through the Red Cross. There's also several blood banks around the country that are actually participating in this, and those are in association with something called the Convalescent Plasma Project. And then there also are some FDA-approved trials underway. So if you want to actually donate, what you want to do is identify some center that's associated with one of those different institutions. Now, in order to be a candidate, if you know someone that's had the COVID-19 or you've had COVID-19, in order to be a candidate, first of all, you have to have a record of proven disease. This means you actually have to have been tested for it. It can't be a case of where I thought I had the disease, but I don't have proof. Beyond that, you also have to have proven recovery. And what we're talking about there is you have to have one of two things. You either have to have complete resolution of whatever symptoms you had for a minimum of 14 days, plus a negative PCR test, or a complete resolution of symptoms for a minimum of 28 days. So testing is another thing that comes back up here. And just to bring up our tests we've talked about quite a bit here, we've discussed PCR in the past, and that's something that shows whether the virus is present or absent. If it's present, it means that person probably is actively infected still. The antibody test, on the other hand, shows that the person has had the virus at some point. It could be in the acute phase, that's short term, or it could be in the long term. But it doesn't actually tell you that they've actually completely resolved the infection. So that's why you see PCR testing featured here. But these patients have to meet one of these two criteria to really prove recovery. Now, beyond that, these patients have to be screened, these donors have to be screened. And they have to verify that they don't have any bloodborne pathogens like hepatitis C, like HIV, and they don't actively use IV drugs, because those things put patients at risk of acquiring those other bloodborne pathogens. Beyond that, they have to be tested for other types of antibodies that can cause significant reactions in patients if they actually are administered to them. So these would actually trigger the patient's immune system to overreact and cause issues. So they do some of that as well. The process itself, if you are a donor, is not like your typical blood donation. Blood donations typically, I think, last about 10 minutes or so. But when we think about convalescent plasma, when we think about plasma donations, it's about 2 hours. So this is a long process. And usually what they do is they sit you down in a room and you get to watch TV, and you kind of sit there with a ball in your hand and you pump the ball to make sure that blood is flowing. And what happens is that blood cycles through a machine and it filters out that plasma component, and it puts the red blood cells, the platelets, back into your system. So you don't just give blood completely away like you normally would. You're just giving that plasma component away. As we've already kind of mentioned, we know that the evidence is sort of weak. We don't have the strongest data, but there is some evidence behind this theory. There are some other limitations to think about as well when we think about convalescent plasma. One of which is we don't know what the optimal dose is. There were several different things that were trialed, and actually most of our dosing for convalescent plasma comes from the older things that we were trying it against, like SARS, when we had the SARS outbreak. There's something called an antibody titer, and really what this is a level of the total antibodies that are present in that plasma. We don't know what the best ratio is for those antibodies when you have a plasma donor. So not every person has the same amount of antibodies that are present, and we don't know what that amount correlates to in some patients' responses. We also don't know that patients won't have any side effects, because we know blood products, when they're administered, sometimes cause people to have reactions to the infusion itself. Sometimes they have allergic reactions, and sometimes they actually can have kind of like this paradoxical worsened infection that can take place. It's really rare that happens. We haven't seen it with the other coronaviruses, but it's something that is kind of on our radar. We've already talked about bloodborne pathogens being a risk, but one thing that continues to come up is we have limitations with testing still. So in an ideal world, anyone that's had COVID-19 or thinks they have could be tested, and that would identify a pool of candidates then that we could try to recruit to get this potential therapy for patients. Because this is also a very laborious process to go through, again, it takes about 2 hours, not every person is going to want to donate. So the supply is a little bit more limited for that reason as well. If you are interested in donating, if you've had COVID-19 or you know someone that has had COVID-19, I'd actually refer you to these two websites, one of which is through the American Red Cross and the other is through that convalescent plasma program that I had mentioned before. So our treatment strategies continue to evolve as we move further into this process. I'll tell you from personal experience, we've seen some success in our patients with this, but again, we don't know for sure if this is actually what's causing them to improve. Moving forward, though, I would just encourage you to think about, if you have COVID-19 or you know someone that does, encourage them to donate, because this is a way that people could potentially try to help out in the midst of this crisis.